Hello, this is Justin Bosnich. I am presenting my signature assignment on lymphoma. We're going to go over etiology first. Lymphoma is a cancer that arises from mutations in mature lymphocytes during DNA replication in the lymph nodes. These cancerous lymphocytes rapidly multiply and live longer than normal lymphocytes. The clumping of diseased and ineffective lymphocytes can cause the lymph nodes, spleen, and liver to expand. The two main types of lymphoma are Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma is defined by the Reed-Sternberg cells, and they are basically large sized in structure, and they have multiple nuclei. Um, Non-Hodgkin's is just anything that isn't Hodgkin's lymphoma, and there's multiple types of them, and it's more common than Hodgkin's lymphoma. The direct cause of this cancer is unknown, but there are several risk factors associated. Autoimmune disorders such as EBV, HIV, HCV, HSV, bacterial infections, H. pylori, for example, um, chronic immune suppression, so post transplantation drugs that will hinder the immune system, and then prior chemotherapy, alkalizing agents also dampen the immune system. Um, Family history, there's a 1.8-fold increased risk of NHL for individuals who have a first-degree blood relative with NHL. Okay, now we're going to go over demographics. Some demographic characteristics that increase the risk of developing lymphoma are age, sex, family history of lymphoma, exposure to chemicals, and autoimmune disorders, which we kind of went over already. Um, so, age, Hodgkin's lymphoma affects most individuals of the age of 20 to 39 and 65 and over. NHL typically affects ages 60 to 80. For sex, males are more affected than females by a 5 to 4 ratio. We went over family history. You're more likely to get it if your family's had it before. Exposure to chemicals. Um, Working in industries with high levels of chemical exposures such as industrial chemicals, pesticides, weed killers, solvents, and even pre-1980s hair dyes. Autoimmune disorders also weaken the immune system, and they can cause um, increase your risk of lymphoma. Okay, globally, NHL is more common than HL. In a global study compiling instances of NHL, the highest incidence rate per 100,000 using the age standardized rate were Australia and New Zealand at the highest, then North America, then Northern Europe, Western Europe, and Southern Europe. And all of them are around 10 per 100,000 people, um, which is surprising that the developed countries have higher rates than underdeveloped. Um, it probably has to do with more in industry and more chemical exposure. And then at the bottom, in the United States, the estimated lifetime risk of NHL is 1 in 48. So it's about 2% chance of getting it during your lifetime. So now we're in anatomy. Lymphoma is a cancer that mainly affects the lymphatic system, most notably the lymph nodes. Um, the organs associated with the lymphatic system are lymph nodes, spleen, thymus, tonsils, and bone marrow. These organs are made up of tissues such as epithelial tissue, cover parts of the thymus, spleen, tonsils, lymphatic tissue, main tissue of the lymph nodes, thymus, spleen, and connective tissues uh, like lymphocytes and bone marrow. The two main things that cause lymphoma are alterations to the T cells and the B cells. T cells activate immune response and attack pathogens, while B cells produce antibodies which attach to antigens. Continuing, the organs of the lymphatic system include lymph nodes, acting as filters which carry lymphocytes that destroy bacteria, viruses, waste, and cancerous cells. Spleen, which filters blood and helps increase blood volume quickly if the individual loses too much blood. Thymus also filters and monitors blood in addition to maturing T cells. Tonsil, similar to lymph nodes. And then bone marrow produces blood cells, lymphocytes, erythrocytes, and the appendix, which contains lymphocytes. Okay, now we're going over physiology and symptoms. A normal lymphatic system regulates and drains fluid that has leaked from the blood vessels. It also uses the spleen and thymus to monitor, detect, and respond to pathogens and cancerous cells in the blood, but lymphoma can cause disruptions to these functions. Signs and symptoms include weight loss, fever and flu-like symptoms, night sweats, painless swelling of lymph nodes, fatigue, shortness of breath, and itchy skin. Um, the top three are inflammatory symptoms, which usually means a worse prognosis because it means your immune system has been kind of destroyed or isn't doing too well. Pictures on the side, swollen lymph node, and a rash up here. Okay, continuing. If left untreated, lymphoma can cause a disruption in the lymphatic system's functions and possibly spread to other organ systems. Lymphoma can also crowd lymph nodes and impede the flow of lymph fluid. It can disrupt the lymphatic system and also give rise to more infections. Um, a large mass can form, which could cause damage to surrounding organs and tissues like the nerves and blood vessels. It could spread to and damage vital organs. And lastly, it could cause death. Uh, this is a mortality rate of Hodgkin's lymphoma in the United States for 2021 is 0.3 per 100,000. Down here, more males are affected than females. And then the mortality rate for non-Hodgkin's lymphoma in the United States, same year is 6.1 per 100,000. And you can see here, more males are affected than females. And you can see this chart. It has different ages too. 75 plus seems to be the worst outcome. So now on to diagnosis and treatment and AI. Uh, the main tests and procedures used to diagnose lymphoma are physical examinations and lymph node biopsies. Other tests used to determine the stage of the disease and help diagnose are chest x-rays, MRI, bone marrow biopsy, PET scan, which is using radiation or radioactive isotopes to find cancer, molecular tests, examine changes to genes, proteins, and other substances in cancer cells, and blood tests to check ratios and numbers of cells and other substances or infections. So this is blood draw. This is an MRI showing growth in the lymph nodes right here. Now we're going over treatments for lymphoma. It can vary and may require more than one of these options. We have active surveillance, which is just monitoring the cancer's progress. Chemotherapy, which is routine injections of chemicals with a systemic effect. Targeted therapy, an example is monoclonal antibodies. These are man-made proteins that bind to uh, the cancer cells and help the immune system find and destroy those cells. And then we have radiation therapy, an example, external beam radiation therapy, which is targeted beams of radiation at the those cancer sites. And then we have internal radiation, which is like chemotherapy, but it involves radiation. Um, then we have bone marrow transplant. You need a donor for that. Takes red bone marrow from one person and injects it into the other person. Lastly, we have immune therapy. An example is CAR T cells. These T cells are injected and they activate your immune system to attack specific antigens of those cancerous cells. Okay, finally, we are going over artificial intelligence. So, the research into artificial intelligence has made progress in early diagnosis of several different types of lymphoma. 92% accuracy in classifying between three common lymphoma subtypes, predicting prognoses by comparing outcomes of similar diagnostic databases, and treatment planning, predicting personalized treatment responses to uh, certain therapies. These AI models are not being utilized in the clinical field due to several challenges. One of them, equitability and unbiased AI tools. Uh, Second, the need for evaluation and oversight over safety and reliability. There's no regulatory bodies like the F or yeah FDA. Third, integration into clinical practices. They haven't integrated it yet. Four, they also require larger and more diverse databases to increase their accuracy for these AI tools. So more data sharing. And finally, a clear data interpretation explained to clinicians and patients. The results aren't always easy to read, and they don't have uh, they need clinicians to be able to interpret these results. They don't always have like a tech there to read the data for them. Okay, and these are the references, and that's all. Thank you for watching. Hopefully, the cuts I made weren't too jarring, and thank you for watching.